Tess Gerritsen's novel, The Surgeon, published in 2001, is not just the beginning of her acclaimed series featuring Detective Jane Rizzoli and medical examiner Maura Isles. It's a masterclass in psychological thriller writing. Gerritsen, leveraging her background as a physician, seamlessly integrates deep medical knowledge of surgery and anatomy to craft a narrative that is both incredibly realistic and profoundly chilling. She skillfully delves into the darkest corners of the human psyche, explores the devastating consequences of deep-seated trauma, and examines the complex dynamics of relationships between individuals caught under extreme pressure and constant threat. This book stands as a genre benchmark, immediately immersing the reader in an atmosphere of tension, fear, and an ever-present, inescapable danger. Part 1. The Genesis of Terror. Boston Under a Shadow. The story unfolds in a panic-stricken Boston, where the city has fallen victim to a brutal and elusive serial killer. The media, eager to put a name to this unknown monster, quickly dub him the Surgeon. This chilling moniker perfectly reflects his horrifying and meticulously precise modus operandi. He methodically infiltrates the homes of young, solitary women, always acting with an unnerving confidence and mercilessness. The killer employs powerful anesthesia to completely incapacitate his victims, stripping them of any ability to resist or even feel pain. Then, with almost clinical surgical sterility and flawless anatomical knowledge, he performs gruesome operations, removing their uteruses. The victims' bodies are consistently found with clean, almost perfect incisions, leaving no doubt about the perpetrator's medical training and experience working with human flesh. These are not merely murders. They are horrifying, ritualistic acts that evoke a sense of utter helplessness and existential dread among the city's inhabitants. Fear paralyzes Boston, as no one knows who will be the next victim. Against this grim backdrop, we are introduced to Detective Jane Rizzoli, who will become the central figure of the entire series. Jane is a young, yet fiercely ambitious and relentless woman who, however, constantly feels undervalued and marginalized within the predominantly male, conservative Boston Police Department. She is frequently ignored, her ideas dismissed, and her direct, somewhat awkward demeanor, coupled with a lack of expected feminine softness, only exacerbates her professional and personal isolation. For Rizzoli, this case isn't just another routine investigation. It's her life-changing opportunity to prove her professional worth, earn respect, and perhaps even convince herself of her own strength and ability to succeed in this harsh world. She is assigned an experienced but somewhat cynical and weary partner, Detective Tom Moore. Their relationship is immediately fraught with tension, marked by constant arguments, differing investigative approaches, and a certain cat-and-dog dynamic, which nonetheless adds significant depth and realism to their collaborative work, setting the stage for the evolution of their bond. Part 2. The Ghost of the Past. A witness who relives the nightmare. Despite all police efforts, the investigation remains stalled, seemingly without any viable leads. The city lives in constant, escalating fear as the Surgeon continues his gruesome spree. The situation takes a dramatic turn when an unprecedented event occurs, turning the entire investigation on its head. At the scene of his latest crime, the killer unexpectedly leaves one of his victims alive. This fact shocks not only the police and the public, but also, presumably, the Surgeon himself, as it deviates from his established lethal modus operandi. The miraculously surviving victim is Catherine Cordell, a highly skilled surgeon. Her past harbors a terrifying secret directly linked to the current Boston killings. 2 years prior, she survived an eerily similar, almost identical attack in Savannah, Georgia. At that time, her husband was brutally murdered, and Catherine herself sustained severe injuries but miraculously managed to fight back and seemingly kill her assailant. The distinct pattern of that older crime so precisely matches the current murders in Boston that the police immediately establish a direct, chilling connection. This raises a multitude of urgent questions. Could the Savannah killer have somehow survived? Is this a brilliant copycat who meticulously studied every move of his predecessor? And why did Catherine, being a doctor, survive this time, while all other victims of the Surgeon perished? Is there some special, sinister meaning to her survival? Catherine Cordell, now not only a key witness but also a potential next target, becomes a central figure in the investigation. Her presence in Boston brings both hope and added peril. Jane Rizzoli and Tom Moore begin to work closely with her, attempting to reconstruct the events of 2 years ago in meticulous detail. Catherine, still living under the shadow of past trauma, suffers from severe post-traumatic stress disorder and constant, debilitating fear. She is initially very reluctant to cooperate with the police, as her life after the Savannah attack has been a continuous struggle for survival and an attempt to forget the nightmare. However, her medical knowledge, her profound understanding of surgical procedures, anatomy, and the killer's likely psychology prove invaluable to the investigation. She helps the police interpret the smallest details of the killer's signature, pointing out nuances that might have been overlooked by non-specialists. Her experience as a surgeon gives her a unique perspective, allowing her to gain insight into the twisted mind of the perpetrator. Part 3. Deep dive into psychology, personal demons, and the struggle for recognition. Parallel to the intense and relentless criminal investigation, Tess Gerritsen masterfully delves into the multifaceted personality of Jane Rizzoli. The author meticulously reveals her internal conflicts and personal challenges, which make her one of the most compelling heroines in contemporary crime fiction. Struggle for recognition. Jane constantly feels an intense need to prove her worth and competence in the male-dominated, traditionally masculine world of policing. She faces daily sexism, skepticism, and even outright contempt from some colleagues and superiors. She is not taken seriously, despite her sharp intellect, phenomenal memory for details, and unwavering determination. This struggle for equality and respect is one of the central themes of her character arc throughout the series. Complex relationship with her mother. The author vividly portrays Jane's complicated, at times suffocating, relationship with her mother, who constantly criticizes her career choice, her appearance, her personal life, imposing her own conservative notions of normal female happiness and traditional gender roles. This creates additional emotional pressure and a feeling of inadequacy that Jane battles daily, striving to forge her own path. Internal doubts and insecurity. Despite her outwardly tough, direct, and even somewhat aggressive demeanor, Jane harbors deep-seated doubts about her competence and, more significantly, about her own femininity. She fears that her unfeminine traits, strength, decisiveness, independence, hinder her from being an effective detective and a happy individual. This case becomes not only her most challenging professional hurdle, but also a profound personal test that forces her to confront her greatest fears. The dynamic between Jane and Tom Moore is another crucial, multi-layered aspect of the book. Moore, with his years of experience, prudence, and a certain cynicism, often acts more cautiously, adhering to protocols and relying on tried-and-true methods. Rizzoli, in contrast, is prone to risk-taking, intuitive breakthroughs, and sometimes impulsive yet effective decisions. These differing approaches lead to numerous conflicts and arguments, but simultaneously force them to complement each other. They learn to work as a team, expanding the scope of the investigation and pushing each other to view the case from different angles, ultimately leading to crucial breakthroughs. Their relationship evolves from initial mutual distrust to a deep professional respect. The murders continue, and the surgeon becomes increasingly audacious, leaving behind not just bodies but also increasingly complex clues that further emphasize his medical knowledge, perhaps even daring the police. The circle of suspects narrows to medical professionals who have access to specialized surgical instruments, operating rooms, morgue facilities, and profound knowledge of anatomy. The Boston Police Department is forced to seek assistance from the Federal Bureau of Investigation, FBI, which creates additional tension for Rizzoli as federal agents aim to take full control of the case, undermining the work of local detectives. Jane must contend not only with the criminal but also with her own colleagues who are often unwilling to acknowledge her contributions. She must overcome both internal resistance and external pressure to follow her instincts and pursue her unique investigative approach. Part 4. Unveiling the horrific truth, a revelation that shocks. Through relentless dedication, Rizzoli's keen intuition, and her unique ability to spot details others overlook, the investigation finally leads the police to a shocking, unexpected discovery. It turns out that the true surgeon of Boston is not the same man who attacked Catherine Cordell in Savannah 2 years prior. It is an entirely different individual who, however, not only mimics the previous killer's methods, but also shares a deep, psychological, almost obsessive connection with him. The Savannah attacker, Warren Hoyt, was indeed a mentally disturbed and brutal killer, but his methods were more chaotic, less clean, fueled by rage rather than cold calculation. The surgeon of Boston is a young, exceptionally talented, and seemingly promising physician named Andrew Kaplan, who works at one of the city's leading hospitals. His impeccable reputation, high intellect, and outward charm provide the perfect disguise for the monster lurking within. Kaplan's motives are revealed to be profoundly psychological, their roots extending back to his childhood trauma. He suffered severe psychological and physical abuse at the hands of his own mother, and his crimes are a distorted form of revenge, an attempt to gain absolute control over those who, in his twisted mind, symbolize his tormentors. Kaplan is obsessed with the story of Warren Hoyt, whom he doesn't just copy but views as his teacher, inspirer, and even an idol. He meticulously studied Hoyt's methods, striving to prove that he could be an even better, more perfect surgeon killer. Kaplan selected his victims based on his sick belief that they were unworthy or sinful, and performed his gruesome operations on them, convinced that by doing so he was cleansing them and freeing them from suffering, while simultaneously enacting vengeance for his own past. Catherine Cordell, as both a surgeon and a woman who survived a similar attack, plays an absolutely pivotal role in exposing Kaplan. Her medical expertise allows her to understand his deranged mind and twisted logic. She realizes that for Kaplan, she is not merely a victim, but a special target, a symbol of his past failure, and simultaneously an object of desire whom he seeks to complete. The novel's climax occurs when Kaplan, driven by an obsessive urge to finish his work and prove his superiority, attempts to attack Catherine once again. In a dramatic and incredibly tense final scene, Jane Rizzoli, risking her own life and despite all her previous doubts and fears, engages in a deadly confrontation with Kaplan. She uses her quick wit, incredible determination, and newly acquired combat skills to incapacitate him. Catherine also takes an active part in this struggle, defending herself and assisting Rizzoli. This is not just a victory over a criminal, it is a profound triumph over personal fears, insecurities, and past traumas for both women. Part 5. The Aftermath and the Path Forward. At the conclusion of the book, Andrew Kaplan is apprehended, and under the weight of evidence and relentless interrogation, he ultimately confesses to his horrific crimes. His arrest brings a long-awaited sense of relief to Boston, lifting the burden of panic and fear from the city, but it leaves deep scars on the souls of those who endured this nightmare, particularly Catherine and Jane. Catherine Cordell, though profoundly traumatized by the events, embarks on a difficult but incredibly important journey toward healing and recovery. She can finally breathe more freely, knowing the threat is gone, and begins to find meaning in life and her profession once more. Jane Rizzoli, despite all the difficulties, internal doubts, and external pressure, proves her exceptional professional competence and personal courage. Her unwavering will, sharp intellect, and ability to think outside the box were crucial factors in solving the surgeon case, and she finally gained some recognition from her colleagues and superiors. This marks her personal victory, which changes her standing within the department and opens up new opportunities. Her relationship with Tom Moore improves, transforming from tense rivalry into a deep, mutually respectful partnership. Their dynamic remains complex, multifaceted, and incredibly promising for future books in the series, hinting at a potential romantic development while keeping the focus on their professional collaboration. The Surgeon is not merely a successful detective novel, it is a profound, multi-layered psychological thriller that masterfully immerses the reader into the darkest corners of the human psyche. Gerritsen explores the consequences of trauma, its destructive impact on victims, and its twisted influence on the minds of perpetrators. The book demonstrates the indomitable power of the human spirit, its capacity for survival, adaptation, and the importance of inner resolve. It keeps the reader on the edge of their seat from the first page to the last, skillfully interweaving a dynamic criminal investigation with the deep personal dramas of its characters. This novel served as an excellent starting point for a series that introduces complex, realistic, and memorable characters, setting a high standard for the entire crime thriller genre, and paving the way for the further captivating adventures of Rizzoli and Isles. Furthermore, Gerritsen raises important societal issues, such as sexism in law enforcement and the psychological pressure on women in male-dominated professions.